Now, do you have a foreskin problem or a problem with the skin at the end of your penis? Many men live with ongoing discomfort, way longer, far longer than they really need to. Often the symptoms might be subtle at first, a little bit of tightness, occasional soreness or irritation that comes and goes. And because they're not really that severe and it's not overly bothering them, they will live with this until these symptoms are so persistent they start interfering with either sexual function. So during sex, the foreskin gets pulled back, it's tight, it might tear or crack, or they get repeated infections on the head of the penis, or it interferes with the flow of urine, or they may get urinary infections. If you have any of these issues, difficulty cleaning the foreskin, difficult during intimacy, difficulty peeing, repeated infections of the head of the penis, it's more than likely you've got an issue with the foreskin, and we call it phimosis when it's too tight. And it can either be partially tight, so maybe you can pull it back when it's flaccid, when it's soft, but when it's erect you can't pull it back, or maybe you can't pull it back at all, and that's a more severe issue. Why circumcision may be recommended. So adult circumcision is not routine, but it's considered when there is a clear medical reason. The aim is to eliminate that recurrent tightness, prevent repeated inflammation or infections, and improve the comfort of the penis, particularly during intercourse, and provide a permanent resolution to this tight, possibly tearing or bleeding skin. The decision is always made as a proper assessment and two-way discussion, going through the benefits as well as going through the risks of having a circumcision. At the Health Suite, adult circumcision is performed under a local anaesthetic. This means you are awake, but the penis is fully numbed so that it is painless during the procedure and for many hours afterwards. The procedure takes about an hour. It's completed as a day case. You'll be able to go home the same day, but get somebody to drive you home. We use a careful, structured surgical approach. We use scalpels, diathermy, dissolvable sutures. We use a dressing which is composed of an antibiotic ointment, a special seaweed dressing and an elastic wrap, but it allows you to pee and it allows comfort for the first 24 to 48 hours. Many men simply just need reassurance, and sometimes it's just a consultation, and we may be recommending some conservative measures like steroid creams. But if symptoms are persistent, you may need a circumcision, and we can talk you through what's involved with that, and then if that's right for you, it's something that can be performed here. So if you are experiencing recurrent tightness, irritation, discomfort, come along for a straightforward consultation. We can talk you through what's going on and whether or not anything further needs to be done. And if needs be, we can arrange that for you.